This voiceover is part one of two voiceovers for considerations in caring for children and families that have been diagnosed with a chronic condition. Those are our learning outcomes. So first of all, how do we define a chronic condition? It's a condition that lasts any greater than 3 months in time. The impact of that disease, as you can see here, depends really on what is the condition, what is the stage of growth and development in which the child has been afflicted, and the family's ability and capacity to be able to deal with the chronic condition. Some of these can be inherited, and I've given you some examples: sickle cell disease, cystic fibrosis, muscular dystrophy. Some of them can be congenital defects or insults that occur during fetal development. So cleft palate would be an example of that. Cerebral palsy caused by a lack of oxygen during the birthing process could also be a condition that develops as a result of, that would be a chronic condition rather. Insult or injury that is associated with birth or the care that follows it. So if a patient develops sepsis, or we have a preemie, premature infants often develop something called bronchopulmonary dysplasia, a chronic lung condition. They also can additionally have issues with hearing impairment, vision impairment, that we would consider long-term chronic conditions. And then those that can be acquired during from an injury or an illness. An example would be cancer, HIV, etc. So categories of special health care needs. So we could have a couple different types of categories. Number one, they're dependent on medications or special diets. Example, diabetes or asthma, some of the most common chronic conditions we see. Some are dependent on medical technology. I mentioned that bronchopulmonary dysplasia, which we'll learn more about in our respiratory lecture. Patients with renal failure could also depend on technology. Increased use of healthcare, patients that develop cancer, sickle cell disease, cystic fibrosis are examples of those, and functional limitations would be a child with Down syndrome. So children with special health care needs make up about 19, almost 20% of the children in this country have what we would deem a special health care need, which is one or more chronic physical, developmental, behavioral, or an emotional condition. So some categories: limitation in function, developmental disorders, behavioral disorders, anatomic problems, limb dysfunction, dependency on meds or special diets, and dependency on medical technology. So numerous categories, really. So things that families and children with special chronic conditions need. They need help with access to healthcare. They oftentimes need multiple healthcare providers, and some may need transportation to those multiple appointments, especially if they're wheelchair bound and need to have proper transportation for a wheelchair or equipment that goes with them. They need to have the appropriate levels of care for those that are experts in dealing with the types of conditions these kids suffer from. They need primary, secondary, and tertiary needs met. They need someone to be a care coordinator for the numerous individuals that may interact with them in the care of their children. They need continuity of care, so we need to have the same medical facilities. Many of these young children require care from nursing in the home, and we are often involved with continuing and the continuity between home care and inpatient care. And finally, as with all pediatric care, we need to really do family-centered approaches. This is an incredible stress on the family unit, bringing home a child with a chronic condition. And all of our care should be aimed at family-centered approaches, including the family in care, and they are a patient as much as their children are patients. Our role as nurses for chronically ill children and families, provide that health supervision and guidance, collaborate with the family and partner with the family and their healthcare providers to ensure that we're all on the same page. And that even may include working with the school for some of these children if they are in the school. Refer the patients to any community services that we're aware of that will be helpful in caring for these children, and assist them with how they access education planning, whether it's in school or home school. Promote how the parents care for their patients or their children, and promote growth and development, not only of the patient, but also of the siblings. I've worked with chronically ill children for years, and one of the saddest things I've seen are how siblings of these children tend to react to the process. Many of them don't get as much attention from their parents because the parents are so focused on the needs of the child. They can feel less than, secondary, and they can develop an anger towards the child with the special needs. It is vitally important that we pay attention to the siblings before we start to see complications and problems that we have seen in terms of acting out and really becoming difficult to deal with, because ultimately they are angry about the disruption in their lives, the disruption in the family's lives, and their lack of time with their family members. It is important that we are assessing all the time how well does the family understand the condition, how well is the family managing all of those things, what exists that we would deem as a positive strength in the family, and what are some risk factors in those families. And we've talked about positives and risk factors in families and environments in other lectures, but it is important to continue to always do that, but even more importantly in patients or families with chronically ill children. The potential for abuse and neglect is higher for the special needs child, and that we need to bear in mind. I will put the next part of this lecture on another voiceover just to keep the voiceover short, and we will begin with this slide on the next one and kind of looking at developmentally, what do we need to think about when we have a child with a chronic condition.